let's get into it. Today we're going to be talking about basic socket preservation. Um, and I think one of the things we really want to touch base on is what can be the most common mistake when it comes to basic socket preservation and possibly how it can be avoided.
Sure. I mean, I would say probably the biggest challenge to socket preservation is just getting case acceptance. In my career, I've worked with general dentists. I've also worked with DSOs quite a bit, and we talked about any doctor that does an extraction, where they're taking a tooth out, right? I worked actually with one DSO, and I said, what's the percentage of cases where you extract a tooth, and you actually place the bone graft? And it was somewhere in the 20% range. And yeah, which is exceptionally low. So essentially
Yeah.
the patient's getting the tooth extracted out and the doctor's just, basically leaving it empty, leaving that socket empty without putting any bone graft material. And so my question was to the DSOs. I said, why is the acceptance case so low? And I said, well, the patients just don't want to do it. They don't want to pay for it. And my question was, how are you presenting this to the patient? You know,
Right.
it Right. It shouldn't be presented as like an an unneeded add-on, like getting a rear spoiler in your car or something like that. Because when you're taking a tooth out, I think a lot of times the patients feel like, if I don't want the implant, then why get the bone graft? Right. So,
Right.
that's the question. So I was letting the clinicians know that really what you need to explain is that if you don't get a bone graft when you extract that tooth, even if you don't want the implant, you can't afford the implant or it's not an investment you want to make, there are consequences to that. And what it is that you have an alveolar bone in your jaw, and basically when you chew, the tooth, that's stimulating that bone. So there's a principle called Wolff's Law, and essentially it's if you don't use it, you lose it, is really what it is.
Right.
So it's like your muscle atrophies.
Mhm.
That's what happens to your alveolar ridge. So maybe you don't get the bone graft in that socket. Well, months and years later, what happens is that bone right there atrophies some. So what
Mhm.
happens? And what happens is those adjacent teeth start to migrate in that space.
Right.
Okay. That's why when you see people who've had dentures for many, many years, right? Gradually, what happens is that the bone resorbs and resorbs and resorbs, and then they complain that the denture doesn't fit. And that's because the shape of their mouth is their contour is changing because that bone is just melting away. And that's why dental implants are such an integral part now of dentistry, because that's a way where you stimulate that bone and that bone stays alive. So what I would tell doctors is, you really need to explain to your patients this is standard of care. If you do
Mhm.
not do this, you will essentially get that resorption. You could get that adjacent tooth movement, and then you don't like the way you look. You go in, and a simple socket preservation is now turned into a ridge augmentation, and then we're talking from hundreds of dollars to thousands of dollars. So,
Absolutely. So it's a necessary step one.
it's a necessary step one. And again, I don't I try to explain to clinicians that again, you're doing the patient a disservice if you're not telling them how important this is.
Right. Absolutely.
Yeah, and then I would say probably, the second barrier to it is just the trepidation about doing socket preservation. What materials I would use, am I comfortable doing this procedure and things like that.